Being able to see the world clearly makes it easier to learn, work, and allows us to connect with our surroundings. The cornea is located at the front of our eyes and plays an important role in how well we see. I had the chance to stop by Vance Thompson Vision, where I spoke to Dr. John Berdahl about the cornea and how they can treat common corneal diseases. Hi, John. Hey, let's get started. We're going to talk about the cornea today, so I think probably the easiest thing to do is to start out with what is the cornea?
Yeah, so the cornea is one of the most fascinating parts of the body. It's the clear cover of your eye. So where you would put a contact lens, that's right on top of the cornea. And the cornea really has three functions. One, it transmits light, so it lets light go through. It's transparent. Number two, it refracts light, so it bends it so it focuses on the right part of your retina so that you can see well. And then number three, it provides a structure to the eye. Now it's amazing how we're designed because it's made of the same exact material that the white part of your eye is, which doesn't let light through, and that's because it's organized in such a way that it's got parallel collagen fibers that let the light waves through and focus it right on the exact spot you want it to be.
So let's talk about the importance of tearing and how that's important to cornea health.
Tearing is important for the functionality of the cornea, but it does not generate the tear.
Okay.
The tear is generated by the eyelids, and then it covers the cornea. And so you want a nice, good, smooth, transparent, uniform tear film to have good focusing of light on your retina.
So what does the cornea actually do for the eye?
So the biggest thing that it does is it helps us focus the light exactly where we want it to be.
Yeah.
So it needs to be clear, and it needs to be perfectly round, ideally kind of like a basketball. But if it's not perfectly round, you can have astigmatism, or you can have scars, or you can have it swell, and as light comes through, it gets scattered and bounced around, and you don't get a good, crisp, high-quality image.
Are there common diseases that are associated with the cornea?
The most common surgery that we do on the cornea is LASIK, where we change the shape so it becomes perfectly round, just the way that your glasses can make up for it. But there's a lot of other diseases that can occur to the cornea too.
Yeah, so what are those diseases?
Yeah, so probably the most common conditions of the cornea would be dryness, but like we talked about before, that's not really the cornea itself, that's the lubricating tear film. So we won't talk about that too much. But more commonly is a condition called Fuchs dystrophy. So you have this cornea, and it's about as thick as your credit card. That's all the thicker your cornea is. And there's 5 layers, and the inside layer are called your endothelial cells. And they've got one job. They pump fluid out of your cornea and into your eye. And if you have Fuchs dystrophy, which you're born with, but it doesn't start to cause the problem usually until you're in your 50s, those cells can no longer pump fluid out of your cornea into your eye. Then your cornea swells, and when it swells and light comes through, it gets scattered, and things like driving at night become really difficult. So the way you treat that most common condition is you do a cornea transplant that comes from a cadaver. You remove that just inside layer of cells with a surgery called a DMEC or a DSEC. You take that out, you put the new transplant in there, and then that sticks to the back of the cornea like a window cling. It pulls that swelling fluid out, the cornea becomes compact, and now you can see well.
Are there anything that patients can do to prevent any cornea diseases or lessen the cornea health at all?
Everybody should have an eye exam every couple of years by their regular eye doctor.
Okay.
And that's just good eye hygiene, and go to your regular eye doctor, and every time that they look at you, they'll look at your cornea and they'll discover something. The things that you might notice are, one, if you have pain, especially if you wake up in the morning and your eyes really hurt, that could be a condition called anterior basement membrane dystrophy, and we'll talk about that in a second. So that's one thing that patients could look for. Another one would be, hey, my vision is getting worse. And obviously you're going to want to go in and see your eye doctor about that.
Does dry eyes have anything to do with it?
Yeah, it can, but so let's talk about anterior basement membrane dystrophy. The surgery, or what we talked about before with Fuchs dystrophy, was the inside layer.
Yeah.
There's also an outside layer called the epithelium, and that sticks to the middle layer, which is called the stroma. That sometimes, in about 10% of people, doesn't stick that well. It's kind of like peeling paint on a wall. And so what happens is, if your eyes get too dry, when you go to bed at night, your eyelid sticks to this layer, and you open your eyes and you tear a little piece off. and it hurts like the dickens. and over a half a day or a day, it heals itself up and it's fine. But if that happens on a repeated basis, just like peeling paint on a wall, what really needs to be done is we need to remove those cells. We polish it with a laser, and those cells come back and grow and stick better, kind of like scraping paint off the wall, priming, sanding, and then repainting a wall. And there's one other common condition of the cornea that we should probably talk about, and this is something where people do something wrong, and it's called keratoconus. So if your cornea is supposed to be round like the surface of a basketball, keratoconus, it becomes pointed, kind of like the tip of a football, so it becomes cone-like, and that's where we get the name. Kerato meaning cornea, cone meaning cone-shaped.
Sure.
And that progressive bulging of your cornea is for two reasons. One, you were born with a weak cornea, and number two, you're probably rubbing your eyes. And when you watch someone who has keratoconus rub their eyes, they'll take their knuckle and they'll just get in there and they will grind on it. And people really, really need to not rub their eyes. I don't mind so much if you rub and you feel bone under it, but if you feel eyeball under it, that's no good. And the treatment for that, thank goodness we've got a new treatment for it. It's called cornea cross-linking, and it was approved a couple of years ago. And what it does is it stiffens that cornea so it won't bulge anymore. In fact, it even flattens it a little bit.
So is the recovery process or the treatment itself, does it take a long time for the patient to heal from any of these procedures?
ABMD, anterior basement membrane dystrophy, where you scrape the surface and let it and smooth it out with a laser and let it heal back up, that's probably a week to 2 week process where you get 95% of the way there in 3 months. You're great.
Sure.
Very similar when you replace the inside layer of the cornea. Cross-linking is kind of a week or two, and you start to get the stabilization effect, but that continues to even improve up to a year's time. Where the full thickness cornea transplant, that takes about a year, and we're removing sutures as we go on. So we really want to avoid that last one if we can.
You can learn more about Vance Thompson Vision and the many services they have to offer by calling the number on your screen or by visiting their website at vancethompsonvision.com.